All right, and there we go. Okay, so what we're gonna do here today is we're gonna ask you a few questions about your views and experiences on your clinical readiness for your clinical rotations.
Okay.
Um, Basically, what I'm gonna do is going to interview you, record it, all right, and then what I'm gonna do is going to transcribe it, all right, and then from there I'm going to send it back to you, and you could confirm that this is you saying this, or you want to change anything or modify anything, just let me know. Okay?
Okay.
All right. So, one thing real quick, just want to do something for my phone.
Okay.
Display. Hold on. All right. So we're good.
Yes.
All right. Cool. Okay. So what I want is, can I have your age, please?
I'm 26.
Okay, 26. And how many years of experience are you as a PT?
6 months.
6 months. Excellent. Perfect. All right. And what type of school did you go to? Was it graduate school? Was it a combined degree, like biology and DPT?
No, just graduate school.
Graduate. Okay. And how many years were you in PT school, including um, your clinical affiliations?
3 years.
3 years. Okay.
Three
Gotcha.
and a half, I guess.
Yeah, 3.5. Give or take, standard. All right. So, question number one. All right. I just want you to talk to me about your clinical readiness after your didactic curriculum. Meaning, how, like, again, just to, sum it up, is like, tell me more about how ready you are prior to your clinical rotations.
Like how ready was I, like right before I went to my rotation?
Yes.
Well, I went to Stockton University. It was a little different. My first rotation was after my second year, my summer of my second year of school, so I didn't have all of my lectures under my belt yet.
Okay.
I didn't do neuro PT yet, so I wasn't really ready for the neuro patients, which kind of like messed me up a little bit, I would say. I wasn't really ready for that.
Okay.
So my first clinic was kind of iffy. But after I did that, we had our lecture, and then my third, like winter and summer, was just clinical. And I felt ready at that time. Which it was different though, because I feel like when you go into the clinic and you have a real patient in front of you, it's so much different than sitting in a classroom, you know?
Yes.
And that's like the hardest part, because like you can get yourself ready in so many ways, but just sitting there with an actual patient, like not your peer, like that you're practicing on.
I know, right? Yep. That is something.
Intimidating.
Yeah. Exactly. Um, Now, did you feel more prepared after you came back, did some of your curriculum for your like the other two rotations that you did?
Oh, definitely, yeah. Especially like by when I went back in the classroom, I was able to look back and think of patients that I worked on while I was in the classroom,
Okay, good,
and I'd make connections that way.
good. And so you felt more prepared. So again, describe to me how you felt. What did they do for you to make you more prepared after your first real, clinical rotation?
Well, they would send me to, like, once a week or a couple times they would send me to a PT place, and I would shadow another therapist, which kind of helped.
Okay, yeah.
Like, while I was in the classroom, I was able to think back, like, what I did the day before that and think of patients that way. That's pretty much.
Gotcha. So just to reiterate, everything is what they did is they sent you out to kind of like the shadow that helped you understand more about the clinical operations and how you could relate some of the patients that you saw there to what you're going to see during your clinical rotations.
Exactly. Yeah.
Good. Now, again, after you did your neuro rotation, all right, then you probably had an orthopedic and your probably subacute or acute care.
Acute care.
Okay, so like again, did you feel again more prepared to do both those clinics as well too?
That was probably the scariest clinic I've been to, is the acute care.
Okay.
It's different. It's nothing I've never done before.
Okay, so you pretty much weren't as prepared for that.
Yeah. I mean, they did the same type of thing where, like, we went to a hospital and we shadowed a therapist there, but
Okay.
It's so different, like, to actually be there for, like, 10 weeks.
Gotcha. And explain to me a little bit more about, like, how you felt during that time.
Having patients hooked up to, like, machines and trying to have to negotiate the hospital room was very hard and something they didn't really teach you. I mean, we faked having an IV in the lab in school, but there's only so many ways you can actually practice that.
Yes. I agree.
Yeah.
I agree.
Yes. And to have to call like a nurse stat in the hospital is something that we didn't go over either. It's like having a patient like fall or have like a seizure and anything like that is something that we didn't go over in school yet that I wasn't really prepared for.
Okay, so
I knew what to do, but we never practiced it.
okay, so pretty much you didn't really get the real life situations, and they probably just explained to you or educated you this is what you're going to do it, but you never really practiced that in real time.
Yes, I feel like I was ready, like, in my mind, like, with, like, lecture material. Like, I felt like I knew everything to do. It was just, like, the real-life situations that I wasn't ready for.
Yes, the human effect.
Yes.
Okay, so you felt like you were prepared, or it didn't give you that readiness for that kind of human experience and how you felt when you had to do something more live.
Yes.
Okay, great. All right. Anything else do you want to talk about more about your clinical readiness after your didactic curriculum?
I don't think so. I think that's pretty much it.
All right. Excellent. All right. So we're going to move on to question 2. All right.
Okay.
And I want you to talk to me about your confidence level prior and then during or after your clinical rotations. So let's first off with how confident were you going into your first clinical rotation?
I was very nervous during going into all my clinical rotations. I knew that I do everything in my mind, but actually walking in and going into a new place was nerve-wracking.
Yes.
I wish that my program gave me some tools to decrease my nerves because I'm a nervous person in general, and I'm a quiet person, so it's hard to put myself out there.
Okay.
And what helped me gain more confidence is that I would keep a notepad with me, and I would write down everything I would prepare my evals on the notepad. I would write down the patients I would see, and I would write down what I would think I wanted to do with them and that day and everything that I would do to write in my assessment, and that helped me boost my confidence a lot. By my last clinic, I felt more like a peer than a student, so I felt like I was actually a PT.
Good. Wow, that's pretty good. Now, did your school help you, decide, okay, take that journal with you to help you, with certain the issues that you had going in?
That was something that my CI told me to do.
Really? Okay.
Yeah.
Okay. Did you by any chance talk to anyone back at your school about doing that might help some of their students?
I did, because we would always meet after we got back to the clinic, because we still had that, we we had more meeting time, we would always meet with our advisor when we got back, and I would tell them what I did and how it went.
Okay.
And take our advice.
Gotcha. Excellent. So pretty much your confidence level is very low. If you had to give it a 0 to 100, how is your confidence level going into that clinic?
I would say it'd be about like 50%.
Okay.
And by the end, I would be like a good like 95.
Gotcha. Excellent. Okay. And, so then talk to me more about your second and third clinic, about your confidence.
It was a little more. They're going into my second clinic because I've already had one and I knew what to do.
Okay.
The patients in my second clinic were more neuro-based, so it was different. I had the education about neuro, so I felt more confident about it. And then by then, I felt like I had a flow. It was just the first week. I feel like my confidence was low, and then after that, I got the flow down, and I knew what I was doing. I knew my patients, and I got better at it. We were just getting a couple evals down, and then I was able to know like what I was doing.
Good. And how about for your third clinic?
My third clinic was my acute care
Okay.
clinic. So that took me a little bit longer to get used to, so my confidence was down for a little bit. But then I was able to boost it, and I think I found my niche with it. And by the end of that, I felt great.
Good. Now, tell me a little bit more about how your didactic curriculum impacted your confidence level.
I feel like it boosted my confidence level in some ways because I felt like going in, I felt like I knew my stuff. I was able to ask questions that I needed to, and then I was able to answer them if my students challenged me with questions. And then I was able to go home and look at my curriculum, like my lectures, and with my patients, and kind of make connections and see like what I needed to do.
Okay, good. All right. Anything else you want to discuss about your confidence level during your clinical rotations?
I don't think so. I just that it changed so much from the beginning to the end.
Yes, definitely. I could tell that. That's very interesting. On how I think from my standpoint, I did also have a similar experience where they put me into a clinic like in between I guess it's my second and third year. And yeah, I did not feel confident because going in, but until the end, actually, at the end of the clinic, it actually stimulated me to actually my last 2 semesters at my college. I felt my clinical experience helped me a lot during my last 2 semesters.
Oh, definitely.
So, all right, great. Okay, so I'm going to go on to the third question. So, tell me more about the areas of your curriculum that prepared you for your rotation.
Okay. As much as I hated practicals, as much as they stressed me out, they did help me a lot.
Okay.
I felt like they helped me get my subjective info because we went through an actual eval with our practicals. So I was able to think on my feet, kind of get what I needed, and just make connections that way. And it gave me kind of the right tools because I know it's not a real patient you're working on, your classmate, but you're actually able to simulate an actual eval because you only have certain tools, you only have a certain amount of time to do all of it.
Yes.
And also labs. The labs definitely help getting some hands-on. And then again, you're working on your peers, be able to you're not able to perfect it, but you're able to get as close as you can.
Yes.
And also we did bring in real patients into the classroom sometimes when we had when we had to write notes on patients. We brought one in and we would do a eval as a class to get other people's views, and our professor would simulate an eval in front of the whole class, which helped a lot.
Okay.
And then it was different for when we did our pediatrics module in school. We had a baby day where actual babies came into the classroom, people would bring in their children, and we'd be able to practice on them. That's something that I guess you don't really get a lot of.
Yes.
And I had pediatrics in my second rotation, and just that I was able to kind of put my experience there into my clinic helped tremendously.
Really, that's good. That's good. But yeah, I had just one day with pediatrics, so I definitely would not do any type of pediatrics anywhere. from that. But that's good. Looks like they really prepared you. Now, speaking of your when they brought in real patients, how many times do they do that for you?
Oh, probably once per module. We had about like 6 modules, and like I think for each one they would try to bring in one patient that's simulated, at least one. Like for ortho, they bring in an ortho patient.
Okay.
Pediatrics, they brought in the babies. You know what I mean? They make that way.
Yes. Okay. Okay. Good. Now, on your practicals, yes, like you said before, it was you're working on your colleague. How did that affect you going into your clinical affiliation?
It's different because when you go to your clinical affiliation, because you're working on somebody with an actual deficit.
Yes.
So like you go to your classmate and there's nothing wrong with them, you just have to pretend. So
Yeah.
actually like see, it kind of helps because you see a person with a deficit and you know what you're doing.
Yeah. So you rather had someone maybe that might have had an actual injury that kind of made it more appropriate for you when you got into clinic?
Yes, definitely, because I feel like if I had an actual patient that I could see them, I could see how they're walking. I could see and I could see the deficits that they actually have, and I could treat them the way that they needed to be.
Okay.
With an actual, like with my peer, I wasn't able to do that because I just had to make it up.
Exactly. Yes, definitely. I hear you on that one. Sticking with the same question, like how did your learning experiences in your curriculum help you with your decision making and skill level during your clinical rotations?
I think it was more like, sometimes I feel like it was more like lecture based. We would do like groups, and we would do like cases, and sometimes I felt like in the clinic the cases were more complicated because you get that patient that came in with like 3 different body parts.
Yeah.
Whereas in the classroom they would stick to one case and just it would have like a clear outcome.
Yes. So.
Sometimes I feel like in the clinic I would have to come up with my own like thinking.
I understand. Yeah. So basically, they only practice with you more of your like just non-complex patients, but when you went into your clinic, you had to see more of those complex levels.
Yes.
Okay. And how did you deal with that? I mean, you already explained a little bit of like how you like kind of had to develop your own plan. Can you describe to me a little bit more of what you had to do, and did any parts of your didactic curriculum help you with that?
I would always look to my CI for help if I needed to with like a complicated patient.
Okay.
Or like my professors were always available if I needed to. I would email them or call them, and they would help me with anything I needed to.
Oh, that's great. Yeah.
The curriculum helps because, like, again, I would always be able to. Sorry if you hear my dog.
No, that's fine. Don't worry about it.
I would always be able to look back and think of things like in the lecture that would help me with like the complicated patient. And, like if my CI needed to jump in, like that night when I got home, I was able to look back and be like, oh, okay, that's what I should have done.
Understandable. So basically, it didn't help you on the spot, but you went back, looked up on how it could help you. So next time you experience something similar, you're able to, be more prepared and kind of treat them more appropriately.
Yes.
Yes. And did you continue to do that during your clinicals?
Yes.
Okay. So indirectly, it looks like your curriculum helped you during those complex people.
Definitely. Yes.
All right, excellent. And now, again, talk about more about your skill level. Like, again, your, not just your clinical decision making, but like kind of like your decision to perform like this types of interventions versus like a manual treatment, like a mobilization, or deciding what type of exercise to follow up with, or what type of stretch to follow up with.
That's one thing that I wish that my curriculum went more into was the exercise portion. I feel like I was a PT aide prior to going to PT school, and I feel like that helped me more with thinking of exercises more than the curriculum did.
Huh, interesting.
Yeah, so because I was able to think of that when I was an aide and think of exercises that way, where I feel like the curriculum that I went to was more based on the things that are wrong with the patient, like their diagnosis, more than the treatments afterwards.
Can you explain to me a little bit more about that, like the diagnosis part?
Yeah, like the eval part of, they would focus more of having the eval, not the treatment after. Like we would go over manual therapy and all about that, but like more of how to do it and not which population to give it to.
Okay, so just to reiterate and to summarize, you're saying that during your curriculum, they just focus more on the evaluation part and dictated, hey, if you have this diagnosis, this is what you're going to do, or this is what you're going to use for your interventions.
Yes, like I think we have like one lab on exercises as a whole, like on in the back.
Okay, so basically, it was very narrow what you got, and basically when you got out the treatment or when you went into the clinic, it was difficult for you to kind of process a lot of this. But for you already had some experience as a PT aide.
Yes.
Okay, good. That's kind of interesting because I know they focus now a lot on therapeutic exercise, but I think one thing is sometimes what we get down to is the fact that we just teach the exercise, but we never really teach it and test you on it on what type of exercise we're going to give to this specific patient with these types of impairments.
Yeah.
Okay. Good. So to follow up with the next question, the question number 4. All right. Talk to me more about the areas in which you felt your curriculum was deficient in. You already explained a few, but can you kind of elaborate a little bit more on them?
Well, the deficient area obviously would be the exercises and also home exercises.
Really? Okay. Can you explain more about the home exercise?
Because I feel like I knew exercises to give, but like what exercise would you give the very first day, and how often to update them.
Okay.
Also, that's pretty much the biggest deficient area that I thought of when I was looking at the questions, was just exercises as a whole. We had the VHI at Stockton to look at, but that's pretty much like they told us it was there, but we never really looked into it.
Okay, yeah. So, and how did you feel about like progressing your patients, like advancing the exercise, like basically like dose or difficulty?
Another thing, yeah, because I feel like even if we did go over it, we would go over the basics of what to give them and not to what to give them afterwards.
Okay, yeah, that's I do see that sometimes with some of my students at the school that I teach at.
Yeah.
But yeah, that's a big miss of exercise is kind of our go-to right now, and how they really did not fully explain things, but also did not even describe or give you a variety of exercises and how to change it, how to make it better, or actually talk to you when to make it better or worse, or when to decrease it or change it. So
yeah.
Is that kind of how you felt that you kind of you weren't very well prepared, and that's what you felt that you needed, was more of the therapeutic interventions based on dosage, what types, and when to deliver it and when not to deliver it?
Definitely.
Okay. All right. Very good. So again, just want to follow up with that question. Like, so again, tell me about what things you would change about the curriculum that will prepare you better. And you already said one would be the therapeutic interventions. Anything else that you would change about your curriculum that would make you more prepared?
Specifically for Stockton, I would make it so that all of the rotations were after the lecture, because especially for my first rotation, I felt like I missed out because I didn't have the neuro aspect under my belt, which I felt like I could have taken some of those, like the PNF things that we didn't learn. I could have used it in my first clinic.
Okay, yeah.
Obviously, yeah. And I would have liked to visit more. I know it's great to go to the PT places a couple of times, like during rotation, but I felt like having more live patients and having more exposure to that kind of thing would have helped that, or even actually having like the like how we have a therapy source, like having an aspect like that, because we would take all of our notes on paper, and actually having an online note-taking thing in the classroom to help us that way probably would have helped a lot more.
Very good, very interesting, actually. Yeah, that's a very interesting topic right there that you explained.
Yes.
Yeah, because I mean, pretty much the first time I had computer documentation was literally my first time at Kessler, which was like 6 years ago, and it took me forever to learn TS.
Yeah, and I had some exposure to it as an 8, but sitting there and actually doing notes is so much different.
I know, but no, that's good because would you like going back to like you said like you wanted like live experiences? Would you like to have maybe like a pro bono clinic like on campus where you would have to participate and had your own patient load, for
that would be perfect. I know we've talked about it at Stockton because they're always asking us what they should change, but it never actually happened.
Yeah, it's tough. There's a lot of red tape with that too.
Yeah.
But yeah, so I think definitely just giving you more live experiences with a faculty member guiding you would definitely be key, and not just like once a module. I would say more frequently, especially during your last few years, would help you out. I mean, that would,
100%.
yeah, and that would also help you out with a little bit, like you said. You have some, you're nervous. I think that would definitely decrease your nervousness.
Yeah. That would probably solve everything in my head.
Yes, pretty much. All right, are y'all? Do you want to explain a little bit more about your, like areas that you could change? I think you touched upon it very well. Anything else?
I think that's it.
Okay, so the last question is a little bit more narrow. Explain to me how your CIs perceived your performance based on your clinical learning.